So this is actually pretty common. So between 2 and 6 kids before age 8, and that's the age group you just outlined, will have significant oppositionality. And for the younger group, boys are more than girls, but after puberty, girls step it up, step it out, and cause more problems. And often when the parents come in, they'll say things like, the child doesn't listen. And what they mean by that, of course, is the child doesn't do what they said to do, or they're not minding, or they're doing the opposite of what I say, or they're disrespectful, which usually means talking back. And sometimes they may be very overt in saying, I have to tell her 100 times, which tells you a little bit about what's going on with the parenting, actually. So we have to keep in mind that the typical compliance of preschoolers is about 60%, which means 6 out of 10 times you tell a preschool child what to do, they'll do it. But non-compliant children, it may be only 30% of the time that they do what the parents say. And, of course, these things have names. Psychiatry loves to make names. And in the DSM-PC, which is the primary care version of the DSM, they have a name called the aggressive oppositional variation, which is kids who are having these behaviors several times a week, but it's really having minimal impact on the child or family. If it gets worse than that, it begins to affect the child or family and have moderate impact, it's called aggressive oppositional problem. And if it's worse than that, it's called oppositional defiant disorder. And this is the one that parents say, they say, oh, the doctor said they had ODD. And that's what they meant. They often don't know what ODD stands for. They say, well, you've got ADHD and ODD. And that stands for oppositional defiant disorder. And so the current definition of oppositional defiant disorder is a persistent pattern of angry and irritable mood, along with defiant and vindictive behavior, as evidenced by 4 or more of the following symptoms being displayed, and with 1 or more persons other than siblings. And that's actually a real move forward on the part of DSM-5, because a lot of kids act oppositional with their siblings. So that would probably include most kids who have siblings anyway. But now counting other than siblings, they've now divided the symptoms up into 3 categories. So the angry, irritable mood, losing temper, being touchy or easily annoyed by others, angry and resentful. The defiant, headstrong behavior, which is arguing, defying or refusing to comply with adult requests or rules, deliberately annoying people, and blaming others for his or her mistakes. And then the worst one of all is actually the vindictiveness category. This child has been spiteful or vindictive at least twice in the past 6 months. Now, this symptom, the vindictive symptom, is the one with the strongest correlation with later serious problems like conduct disorder. So that one, you have to take special attention to that one. Now, in addition, for kids under 5, it has to be most days for 6 months. If you're over 5, it has to occur at least once a week for 6 months. And the frequency and intensity of these behaviors has to be not within the norm for the child's developmental level, gender, and culture. So keeping in mind the children who have intellectual disabilities and have a mental age of a younger child, you should be judging them based on what you might see in a younger child. Then, of course, as in all DSM diagnoses, it has to have clinical significant impairment in social, educational, or vocational activities. Now, for oppositional defiant disorder, this doesn't have to be in multiple settings the way ADHD does. It can be in just one setting. And guess where it usually is? It's usually at home. And that makes sense because the child is more comfortable at home and spends more time there. And often children are able to behave in school but don't behave at home. Now, if you see it the other way around, where they're acting up in school but not at home, is that the case for your patients, Dr.?
No, I really think a lot of times it almost has to do with parenting, because the parents just repeat the same thing over and over and over. And then they say, they don't listen to me,
Exactly. So here we are. The next slide is the parenting factors. So what you're saying is that in your cases that you're describing, the kids are problematic both at home and at school. So what are some of the things we know that set them up? Well, parents who don't set kindly structure, children really need structure, and consistent attention will find it. even if they find it by acting up. And often these parents are doing poor limit setting, but also inadequate nurturance. So the kid hasn't got anything to lose because they don't feel cared for by their parent in the first place. And that makes it a much harder problem to treat, right? Because you've got to turn up the parent's nurturance as well. So you might say, well, gosh, parents have children because they want children, right? Well, actually, that's not always true, but they fall in love with their children in general. So what are some of the reasons that they might not provide this? Well, often it's depression. And we're talking about maternal depression in up to 30% of parents, particularly parents of kids under 5. Parental alcohol or substance use has a 3 times higher rate of having kids with oppositional defiant disorder. Those parents may be in trouble with the law themselves, again, 3 times more likely to have oppositional defiant kids. Or they may just live in a stressful environment, and they also may have inappropriate expectations for what the child should be able to do, so that they're demanding things of the kid can't do it, and the kid finally gives up trying to do it. So I think it's useful to think about these behaviors as being stimulated by the thwarting of any major developmental need in the kid. And this is helpful to the families also to phrase it in terms of needs, because what are they likely to say about their kid? He's just a bad seed, right? And that's not helpful. That is not helpful to have that view. So instead you say, well, his needs are not getting met, and that's why he's resorted to this behavior. So if we talk about the needs of young children, and these children, 7-year-olds are not so young, but they still have these problems. Kids need help regulating their state of consciousness, like their arousal. They have a need to have a chance for mastering things. They have a need for positive emotional tone, for assistance regulating their negative affect, and they need to learn pro-social behavior and empathy. So if I went over those things sort of briefly, the issue about state regulation, the main thing I'd like to say here about state regulation is that kids actually often these kids who are acting up are also not being put to bed. Excuse me. And so they don't have enough sleep, and lack of sleep leads to this kind of defiant behavior and irritability. So one of the things you should ask about is, are they getting enough sleep? And often, are they getting enough food? Now, in your population there, this Medi-Cal population, asking if the child's eating regularly may be an important intervention, because there's something you can do for that, and it's something the parents appreciate. If you make a referral to them to a food program, that can be very helpful. And if they see this as their kids struggling because they're tired and hungry, they may react slightly differently to that. Then they have a need for mastery, and this may kick in to some of your complaints about the kids acting up in school. And that is, children need a chance to try stuff and master it, but without being overwhelmed. And young children may be overwhelmed by separation from their parents, from overprotectiveness or over strictness, but they can also be overwhelmed because they can't do the schoolwork. So is it your experience these kids often are not on grade level as well?
Yeah. Like all of those things that you just talked about, I really try to break it down and get the moms to understand, and some of them do. Like the nurturing is the biggest thing in my community, because, it's like the families just raise you hard because they think that's going to make you stronger. And, and I tell them, no, they need to hug them when they're acting bad. Just hug them, grab them, hug them, because they're just needing attention. I can do all the other things and plug them into the system and get the mother to do parenting and tell her about the nurturing, the need for nurturing, the need for bedtime, and I really do go into the food thing too, because that is so important. And like they don't pay attention, and a lot of times they'll just, they eat enough, and then we'll go through the whole diet. But the empathy part is something that I have a really hard time doing with the child. And
So do you feel the child doesn't have empathy, or the parent doesn't?
Yeah, the children, when they do these things, they don't have any empathy. And I think that, that whatever structure, whatever happened, turned off. Because a lot of these mothers don't have, a lot of my moms are so stressed that they don't even see in front of them and what they're doing to their kids, you know?
Yes, I think the children are defending themselves from their hurt feelings, and that you're exactly right to be working on the parents and the parents' stress. The next slide actually fits into exactly what you said, that the kids need a sense of positive emotional tone in their house. And when they have positive emotional tone and a stable attachment relationship, this enhances their resilience under stress, which otherwise can evoke aggression. And so when you have things like domestic violence or yelling in the family because the family is stressed out, those things go in the opposite direction. We also know that anxious children are sometimes the ones who look to be non-empathic because they're defending themselves so hard. So anxious children may over-infer aggressive intent and overreact. And that's part of how they get themselves in trouble, is that they're being aggressive before it's warranted. And that's how they're getting in trouble in school. And the information I'm going to give you about anxiety is something that would be helpful to pass along to the school, because if they infer anxiety first instead of malintent, they will respond differently to the kid, and often they'll get a different response from the kid as well. Now, kids have to learn how to handle their negative feelings, right? So how does that happen? Well, typically through parenting, where parents jolly them through things, sort of distract them when they're starting to act negative, model how to handle things, acknowledge it when there's something that's scaring them or making them upset, using words instead, and finding a way to compromise with the kid. But what parents often do instead, parents who have oppositional kids, is that they are using a kind of covert encouragement. And sometimes that's because they project onto the kid somebody else bad in their life, like maybe the kid's father who's in jail now or something like that. And parents who back off and avoid the child's upset feelings often then explode afterwards and do punishment instead. So parents who have trouble tolerating negative feelings have particular difficulty with this. And we have to remember that the parents may be depressed, but the kids may be depressed too. So that's a good thing to keep in mind in your differential diagnosis. And then finally, the need I'm going to talk about here, the last one I'm going to talk about, is the need to be taught prosocial behavior and empathy, which you were just talking about. So how do kids learn this? Well, they learn it by seeing it and experiencing it, right? So when they learn to trade things with their siblings or take turns or wait or ask for things and say thank you and take other people's point of view, they're seeing the effects of their own actions, and that's how they end up recognizing the feelings of others. Now, typically, this is all happening in the first 3 years of life. We shouldn't be still working on this at age 7, but it's not completely too late. It's less likely to happen if the family is overwhelmed, it's a single parent, they have low income and lots of kids. But not all families who are in those situations actually have this difficulty, so it's possible to do it even if you're like that. Now, there's some screening tools. Are you a Chattis user, Dr. Perez?
Yeah.
Yes, good. So
yes,
some of these tools may be helpful to you. Most of these are in Chattis, but in particular, looking at the child's anxiety, either with the pediatric symptom checklist as a general screen, strengths and difficulties as a general screen, or a more specific screen like the SCARED. And then getting a Vanderbilt's important because 65% of kids with oppositional defiant disorder have ADHD, and they may not be well managed. Although you sound like a wonderful clinician, sometimes you don't know how bad it is, and getting those Vanderbilt's back from the school and from home can help you know whether you need to optimize the management more. So when we're trying to figure all this out, one of the most important things is to get a specific example of when the kid acted up and how the parent handled it. You can't use generalities in this regard. People just say he's just bad all the time. What are you going to do with that? You can't actually work with that information. So getting a specific example is very, very helpful. So, for example, if the parent says, he always refuses to put on his shoes when it's time to go to school, but he never, and the parent then, smacks him across the face or something like that, let's say. So you got a couple different problems here. One, what was going on when he started to act up? Well, he was refusing to put on shoes, which might have been his way of saying, I can't stand school. So the parent needs to understand the context in which this is happening. And sometimes that's something that you can help them understand if they can give you a specific example. And then you want to find out, how often, how bad it is, and to what extent it interferes with the family's life. Also do asking about a whole day from beginning to end. But I find that specific examples, even the last thing they can remember, is very helpful in sorting it out. Because what you're looking for here is what I call the ABCG of behavior. You all know about the ABC, right? The antecedent, like what was going on before. In the case of the shoes, he was getting ready for school. What exactly did he do? He refused to put on his shoes and maybe talked back. What's the consequence? The consequence that for that kid was a smack, okay? Now, how did they feel about that smack? Well, now they're feeling angry at the parent, not just frightened about school. So that's not helping them along the way. In some cases, if the parent says, all right then, I'll leave you here and I'll go to work and you just stay home. Well, if that's what the kid wanted because they wanted to get away from feeling like a failure at school, that's actually a reinforcement for the child, even if it's rendered in a harsh way. But the G is the most important thing that people tend to leave out, and that is what was the gap in skills that set up this episode? So in this case, the gap wasn't that he couldn't put on his shoes. The gap was he can't read, for example, something like that. So how do we manage this sort of thing? Well, these are the steps to managing it: clarifying the meaning, educating the parent and the child, treating underlying conditions, providing bypass strategies, behavior modification for dysfunctional patterns, and referral if entrenched. Now, of course, referral, you're feeling discouraged about your referrals, but let's see what we can do before that step. So when I say clarify the meaning, the children, of course, infer meaning too. And if they've decided that their parents think that they're bad, well, they will just live down to that reputation. And so trying to transmit some of these basic psychological principles to families is really important. And often you can do it in the context of, what do you think he'll be like when he's 18? Because when the parents think about that and think about the fact the kid's been suspended twice already, they may say, well, he'll probably be on the street selling drugs. How's that going to be for you? So helping them sort of anticipate the effect of not breaking the cycle now and letting them know they're the grown-ups. So the kid is in the cycle with them, but they're the ones who have to step back and try to handle things differently to give the child a chance to have a different kind of reaction. That's really important because some kids will act badly just to get some response at all. Like if they're getting inadequate attention from the parent, acting up is the main way they get any attention. And sometimes they feel guilty about some real or imagined offense, such as somebody died or they got divorced. Often these families, there has been something like that happened, and they want to be punished for it. So that's part of a deeper kind of thing that needs interpretation for the kid. Now, sometimes kids will only act up with certain people in the family where they have emotional conflict. They don't feel as though that person likes them. And they may misinterpret or act inflexible or explosive to normal situations. Now, sometimes the kids who are like this are the anxious ones that I mentioned who are proactive, but sometimes it's somebody who's on the autism spectrum who doesn't understand or who has a sensory problem as well. So those are things to think about. And then, of course, asking the parent who the child takes after, which I said before, how is it for you to see how discouraged they are? And there's my question, what do you think things will be like in 10 years? Because if they've already written the kid off, they need to re-engage with that. And you could say, well, he's not going to be much of a support to you in your old age if he can't hold down a job. And right now, the direction he's going, he can't hold down a job because he can't get along with authority figures. So we need to start with the authority figures in your house. Something like that to help them connect it to something that's in their self-interest. What kind of education we need? Now, this is a very important one because of the fact that so many kids have ADHD. And that is, as the kids get older, they look bigger and older, but they are still having trouble with executive dysfunction in many cases. And helping them understand that part of ADHD is a problem of timing. It's not that they don't know what to do or they don't know how to do it. It's that their timing is off. So, for example, they can't plan, they don't transition well when they have to move from one thing to another, and they have trouble completing tasks. And part of the reason for that is if you say, clean your room, they go look in their room, and the mess looks like a volcano went off to them. It looks like it would take them too long, like the rest of their life, to do it, because they don't judge those things properly. So helping the parents understand this concept of it looks like a mountain is really important. And then some other things about ADHD is they tend to act impulsively. So the first thing that comes into their head, if it's to punch, they punch. They don't have a moment, they don't have the time to keep from having an immediate reaction. And then they feel terrible because they don't like they made all these mistakes. And then they deny they did it to cover up. You've probably run into that one too.
Mm-hmm.
So helping parents understand this set of things about ADHD can really help, because if they don't understand this is ADHD and not in their kid, they get angry or become rejecting of their kid. And then it's this self-fulfilling prophecy. So what are some of the...
Help them understand that lying may be a compliment to the parent because they want to save face because they care about their parent. Right. That's a concept that is really difficult.
So that was Dr. Sterner speaking about that issue about lying. And sometimes it's true about backtalk as well. So some of the things that parents can do to help the kid not feel so anxious, again, framing it in terms of anxiety, and I'll bet if you think about the bad acting kids that you have in your practice right now, I'll bet you'll discover that a lot of them are anxious. And the boys, they can't just say, oh, I'm scared, right? It's not allowed for boys. So it's more in boys who are anxious that they have this trouble. So things that help is kind of consistent structure, supportive reactions to them, good rules and discipline, and keeping them on a schedule. All of that helps. It also helps if parents can admit their own mistakes. That models it for the kid. Because what we want the kids to achieve by the time they are grown up, right, is to be able to cool off when they get upset, to identify their own triggers for anxiety and either avoid those situations or calm down so they can master them, to use words instead of acting on their feelings. And I recommend using marks for calming down even just a little bit better than before. I'm going to talk about marks somewhere in a minute if you don't know about that already. Watching out for overstimulating them and giving them outlets for their energy. So these are some very helpful things for parents. So we do need to treat the underlying condition, but the underlying condition is most of what we've been talking about: inappropriate expectations, difficult temperament, sleep debt, ADHD. And these things are tough, stressful environments, and traumatic life events. Sometimes the traumatic life events mean that they really do need some therapy. But we shouldn't forget that some of these kids can't hear, some of them have depression, some of them have language disorders, especially receptive language or expressive language disorders, so they can't fend for themselves very well. And, of course, some of them will be having trouble in school because they don't have the IQ, and they have a learning difference, or they have an autism spectrum disorder. Those are all things that need to be thought about when you're figuring out the differential diagnosis. We also have to think about sensory integration problems. It's not just in kids with autism. Any kids who've had some kind of CNS damage, such as from lead poisoning or drug abuse, and, of course, older kids if they're using substances themselves. So I wanted to mention some more about anxiety problems for a specific reason, and that is anxiety sets you up for what's called hostile bias attribution. What that means is this child has a tendency to be watching for something bad to happen. So they see things bad happening when there really isn't anything bad happening yet. So the kid bumps them in the cafeteria line and they punch them, right? It was just a bump. They didn't really mean anything, but they're thinking that people are thinking badly about them. Kids who are anxious tend to be oversensitive to correction, and then they get back at people. They may fear being inadequate to tasks, and then they refuse the task, and then they're seen as being defiant. And, of course, the parents may be anxious, too, because this stuff's hereditary. And they may overcorrect the kid because they're trying to whip them into shape, or they may hover or see defiance too early in a sequence. So recognizing anxiety as part of a key here can be very, very helpful. So what do you do differently if the kid is oppositional because they're anxious? Well, first of all, try to understand it. Try to calm the family down, the pace and the tone. You said about tone. I agree with you completely. It's like Mr. Rogers, you know. Kids love Mr. Rogers because he talks slowly, like he likes you, and I try to mimic that for the family, model that for them. I can't do it very long, but for them to understand, turn down the volume, turn the television off, quiet things down in your house, all those things can help. Then the parent actually needs to go with the kid and help them get started on tasks to protect them from failure and from their own anxiety. And if they do need a consequence, it needs to be smaller and calmer. In general, especially with anxious kids, they need to assume the best of the kid first. Oh, the milk is on the floor. Gosh, I guess that was an accident. Let's clean it up. Instead of, what were you doing? Why would you throw the milk on the floor? Which is the way some people react as their first response. So the bravery marks are really good for anxiety too. Cognitive behavioral therapy works as young as age 6 or 7 if you have a child who has enough verbal skills. And sometimes something like an SSRI can be helpful in anxiety situations too. Basically, the parent keeps a pen in their pocket all day long. And every time the child does something just a little bit better than he might have, especially in the certain categories, like responding nicely, for example, or being braver about going up the stairs or being braver about talking to somebody else, then they get a mark on their hand, aiming for 6 to 10 marks per hour for young kids. Now, then the kid gets a reward for having a bunch of marks, not the number. Actually, this is an old slide. I should fix that. Not the certain number, just having a bunch, because the idea is they should get a reward every day so that they start to feel good about the marks themselves. Now, of course, this isn't instead a way of dealing with aggression or serious problems by using timeout or something like that. And they can get bonus marks if they do something particularly brave or particularly respectful. And then they can phase this out when the behavior is improved and the parent is better at saying what it was the kid did that was good. Now, typically, we're talking 6 weeks, not the rest of your life. This works really well. We have to keep in mind that sometimes kids don't do things because they can't do them. I've kind of made reference to that already. And then we also have to be prepared to help children bypass their gaps in skills. So we want to build up those gaps, right? If they have a language disorder, we get them language therapy. But in the meantime, we may have to help them in situations that are high in language demands. So here are some bypass strategy examples for kids, different kinds of problems. For ADHD, shorter tasks, maybe just one at a time. No failed play dates, like going bowling or to a movie. You can't fail on that, so you can help with your relationship with kids. For learning disabilities, where there's homework, maybe this is a kid who has trouble writing. They should be allowed to dictate or use typing instead, or only do it for a certain amount of time, taking breaks, or only do half the homework to get them into it to be able to accomplish it at all. Kids with sensory problems may need to avoid the situation. They may need to go and practice being in those situations that are overstimulating for them, or even wear earplugs. And then anxiety, they have to confront those anxious stimulation situations, but only in small doses and with comfort and support from the grown-up. Okay, so this is from Russell Barkley, the same Russell Barkley who wrote all those wonderful books on ADHD. He wrote a book called The Defiant Child, which is a whole manual, and it's really a terrific training program with good evidence behind it, and I've boiled it down to about 2 slides here, okay? So the program always has to start with increasing attention to positives. That's where marks can be very useful. The parent has to be watching for the kid to do good things and praising them. Again, this will help with the kid who's attention getting, but also with kids who are just in a rut because they're getting so much negative feedback from adults. Then teach the parents how to give effective commands. So an effective command starts by first turning off electronics, by the way, and then getting the child's attention, maintaining the focus on the child, and giving the command in short, simple language. I want you to pick up the book now. So who wants it? I want it. What do I want? I want you to do what? Pick up the book, and when? Now. So that's kind of the formula for an instruction. And then they have to stop talking. Because what do people do instead of saying that? They say, clean up your stuff. Why do you and your brother always leave your stuff everywhere? You're just like your father. He's such a mess. One insult after another. By that time, the command has been completely lost. So getting the parents to tone it down and keep the command simple and then go silent and watch the kid. That's really important, and I'm going to get to the next step in a minute. So Russell Barkley calls this act, don't yak. So don't just talk, be ready to move. And I like the technique I call one request and then move. So this is one request and then move. You can still do this with 5-year-olds. 7-year-olds gets a little tougher, but might still be possible. Basically, it's what I just said, except that the little mnemonic here, one request and then move, helps parents remember. First, watch for a natural pause in the child's activity. You don't interrupt them when they're almost going to get on level in their video game. Get their attention. Give the instruction in short, simple language. But if nothing happens in 10 seconds, for the young child, the parent should grasp the child and take them along while the parent does the task. And if the child cooperates, they get praise and maybe points for that or marks for that. But the parent doesn't let go until the task is done. Kids hate this. So it gives the parent something they can actually do to get the kid to do the task. For older kids, you don't want to drag them because they might get back at the parent. So instead, the parent towers over them and repeats the request in exactly the same way over again. But every time they have to say it, the consequence goes up. And, of course, praise any cooperation. Now, if you think about what this would be like for your parents to use one request and then move, the first thing you probably think about is how many requests they make per day or even per hour. So to make this work, they have to cut down on the number of requests while they're starting the system. You can't use this and drag the kid around the house all day long. That just won't work, right?
Yeah.
Now, another plan, and this is good for 7-year-olds, is 1, 2, 3 Magic. And there's a book and a video about this. Do you know? Very good book. It's by Thomas Phelan, Phelan. He's got a good series of books, but 1, 2, 3 Magic is really important. Basically, he talks about requests to start a behavior or requests to stop a behavior. And basically, you make the request, the parent. If nothing happens in 15 seconds, the parent says, that's 1. If nothing happens in another 15 seconds, they say that's 2. And if they get to 3, the child goes into timeout or some other consequence. Timeout is what Phelan suggests. And then when they get out of timeout, they still have to do the task. So why does this work? Well, it works because the parent goes silent. So there's less of that negative scolding stuff. It also gives the child a chance to get to do it at their own pace. So Dr. Sterner wants to comment about that.
No, just one modification that I think that if they ever they shouldn't have to get to 3, and they may need to do some acting to up the 2 and give a good pause. Our oldest child asked me not too long ago, he has his own child now, he said, I never knew what was going to happen when you got to 3. That was because we never got to 3, because 3, you're kind of defeated. So when they emphasize the 3 part, I think that's not getting it straight.
And then there are some kids who do get to 3, so keep that in mind. Okay, so that's slide 1 of basic compliance training. And then slide 2 is make sure that they get rewards for doing the right thing. Okay, could be marks, could be tokens, could be pennies, whatever works for that family, so that the child gets something concrete that lets them know they did a good job in small ways. Barkley suggests a compliance hour every day. Now, I suggest a compliance half hour because I don't think anybody's got a whole hour. And here's what happens in compliance hour. The parent says, okay, now we're going to practice you doing what I say. So here, Joey, eat this cookie. So they start with something the kid wants to do anyway. Joey says, oh, this is going to be fun. Eats the cookie. Okay, the next one's a little bit harder. Joey, bring me your jacket, right? And so that they praise them when they've done the task. And they do this for half an hour every day to practice it. Now, this whole system doesn't work well when the parents interfere with each other, or it could be the grandparents interfering. So it's important to tell them whoever starts handling a situation with the kid needs to finish dealing with it unless there's abuse going on. If there's abuse going on, you get a bigger problem on your hands, right? But they shouldn't interfere, because what happens if the father steps in when the mother's in the middle of handling disobedience? What happens? Can the father get the kid to do it?
Yeah.
Yeah.
Usually.
Right. And then how does the mom feel? Like
broken.
a wimp. Right, exactly. So it undermines the kid, underlines the mom in the kid's mind if the dad steps in. Similarly with mothers stepping in on fathers, which also, by the way, in the case of boys, is a put down to boys. So it's a double put down for that kid. Now, if they're non-compliant, they can be put into timeout, but you got to remember that when they come out, they have to do it again, do the task that they were asked to do. And you don't do this in public until you've got it working at home. Very important, because kids know how to humiliate parents in public. So finally, I just want to say that these problems you're dealing with are worthy of your attention, because 40% of severe aggression in adults, like psychopathology, like sociopaths, was evident before the kids were 8 years old. These are the kids you're talking to. Early aggression actually correlates 0.68 with later behavior disorders, especially conduct disorder, which is much more difficult to treat than oppositional defiant disorder. And these patterns of interaction, they start at home, and then they only later generalize to all authority relationships if they don't get treated.
So I want to emphasize one part that Dr. Howard said about get an example. And I just wanted to comment that when I get an example, the most common example I hear about is something that Barbara talked about as gaps, and that is they're stubborn. They don't do what I tell them to do. I have to tell them 1,000 times, all that. But what is actually going on? And what's going on is the most likely thing I see over and over again is that transition problem. And Barbara mentioned it, especially ADHD kids, the part that gets overlooked. People think of them as inattentive. But once there's enough stimulation that engages them in an activity, they just can't give it up. And so transition difficulties. And the parents look at this through a moral lens, and they see stubborn, and you hear them say sometimes he only wants to do what he wants to do. It's kind of a selfishness. It makes them really angry. And instead of seeing this as Barbara said, a gap in skills, the inability to switch from one thing, disengaged, and go on to something that's boring once they're really engaged, then, once they see that, they don't have to get so angry, and there are other strategies. And that would include a timer that's kind of neutral, and it goes ding dong. And I like one I've been using a lot now that has lights that go red, yellow, green, and also has noise. And it just makes it more objective and gets them off their case. And I think if there's any one thing that you could do to, especially ADHD kids, that calm down oppositional defiant disorder, that would be my vote. I don't know what else, when you ask for examples, that's the most important thing Barbara said, I think. And then listen to it and find out what the solution is, because there's so many interventions that you can't do them all, and you have to be case specific. And one example may be the most important thing you get. So great talk, Barb, as usual.